It's 2 a.m. You shift in bed, trying to find a comfortable position, but your knees ache, your hands feel stiff, your lower back throbs with that familiar constant pain. You've learned to live with it. You tell yourself it's just part of getting older. But what if I told you that the very discomfort keeping you awake right now isn't just age, it's inflammation? And what if I told you that something sitting in your kitchen right now, something you probably threw away yesterday, could start reducing that inflammation in just 3 minutes? Here's what most doctors won't tell you. They'll prescribe anti-inflammatory medications. They'll recommend expensive supplements. They'll say inflammation is a natural part of aging. But what they rarely mention is that one of nature's most powerful anti-inflammatory compounds is hiding inside a common vegetable you've been eating your whole life, the humble onion. And I'm not talking about cooking it. I'm not talking about eating it with your dinner. I'm talking about a specific raw application method that targets inflammation directly, works while you sleep, and costs less than $1. This sounds completely backward, doesn't it? We've been conditioned to think that real medicine comes from a pharmacy, that natural remedies are old wives' tales, that if something this simple actually worked, everyone would know about it. But the research is clear, the science is solid, and thousands of seniors are already experiencing dramatic relief using methods I'm about to share with you. Let's talk about what chronic inflammation is actually doing to your body right now. It's not just causing pain in your joints. It's attacking your cardiovascular system, increasing your risk of heart disease and stroke. It's degrading your cognitive function, accelerating the processes that lead to dementia and memory loss. It's breaking down your muscle tissue, making you weaker and more prone to falls. It's stealing your energy every single day, making simple activities feel exhausting. It's disrupting your sleep, which creates more inflammation, which disrupts your sleep further. It's a vicious cycle. A 2021 study led by Dr. Sarah Morrison, published in the Journal of Nutritional Biochemistry, investigated this exact issue in adults over 65 with chronic inflammatory markers. The research team divided participants into two groups. One group consumed raw onion compounds daily. The control group received a placebo. The results were remarkable. The group receiving raw onion compounds experienced a 47% reduction in C-reactive protein, a key inflammation marker, compared to the control group. Their joint pain scores dropped by 52%. Their mobility improved significantly. But here's what makes onions so special. They contain two extraordinarily powerful anti-inflammatory compounds. The first is quercetin, a flavonoid that acts like a natural fire extinguisher for inflammation throughout your entire body. The second is a family of sulfur compounds that don't just reduce inflammation, they actually help your body repair the damage inflammation has already caused. I'm going to show you 5 specific methods for using raw onions to target inflammation. Some take just 3 minutes. Some work overnight while you sleep. Some provide immediate relief for acute joint pain. And the most powerful method, the one I'll save for last, combines multiple approaches into what I call the overnight absorption protocol. You can do these right at home. No special equipment needed, nothing expensive. Just onions and a few simple household items. Ready to finally fight back against the inflammation that's been stealing your quality of life? Let's begin. Method number 5, the raw onion compress. This first technique is perfect for targeting localized inflammation in specific areas like swollen knees, inflamed wrists, or painful elbows. The raw onion compress delivers quercetin directly through your skin to the inflamed tissue underneath. Here's why this works. Your skin is not an impermeable barrier. It's actually semi-permeable, meaning certain compounds can pass through it and enter your tissues. The sulfur compounds in raw onions are small enough to penetrate your skin, especially when combined with slight pressure and warmth from the compress. Here's exactly how to create and apply it. Take 1 medium yellow or red onion. Red onions contain slightly higher quercetin levels, but yellow onions work excellently as well. Peel the onion and slice it into rings about 1/4 inch thick. You want them thick enough to hold their shape but thin enough to conform to your joint. Take 3 to 4 rings and place them directly on the inflamed area. Your knee, your elbow, your wrist, wherever you're experiencing swelling or pain. Now cover the onion slices with a clean cotton cloth or thin towel. The cloth holds the onion in place and helps retain moisture. Secure it gently with medical tape or loose elastic bandage. Don't wrap it tightly. You're not trying to restrict circulation. You're just holding the onion against your skin. Leave the compress in place for 15 to 20 minutes. During this time, the active compounds are penetrating your skin and beginning to reduce inflammation at the cellular level. You might notice a slight tingling sensation. That's normal. That's the sulfur compounds going to work. After 20 minutes, remove the compress and gently rinse the area with cool water. Don't use soap immediately, as you want to give the compounds a bit more time to absorb fully. Pat the area dry. Here's the pro tip. Do this compress application twice daily, once in mid-afternoon and once before bed. The afternoon application reduces inflammation that's been building throughout your active day. The evening application works while you sleep, when your body's natural repair processes are most active. Many people notice reduced swelling and improved range of motion within 3 to 4 days of consistent use. Method number 4, the raw onion juice application. This next method takes the anti-inflammatory power of onions and concentrates it into a potent topical solution that you can apply precisely where you need it most. Raw onion juice contains the highest concentration of quercetin and sulfur compounds because you're extracting the liquid essence of the vegetable without any dilution. Think of it like concentrated medicine versus a diluted dose. The juice form also absorbs faster because it's already in liquid state. Here's how to extract and use onion juice safely and effectively. Take 1 large onion and cut it into quarters. Place the quarters in a blender or food processor. Pulse until the onion is completely liquefied. It should look like a thick, white liquid with very small pulp particles. Pour this liquid through a fine mesh strainer or cheesecloth into a clean glass container. Press down on the pulp to extract as much juice as possible. You should get about 3 to 4 tablespoons of pure onion juice from 1 large onion. This is enough for several applications. To apply the juice, dip a clean cotton ball or cotton pad into the liquid. Gently dab it onto the inflamed area. Don't rub vigorously, just pat it on and let it absorb naturally. The area might feel slightly warm or tingly. This is the active compounds penetrating your skin. It's a good sign. Leave the juice on your skin for 10 to 15 minutes, then rinse with cool water and pat dry. The smell can be strong, so you may want to do this before a shower or at a time when you're staying home. Here's what's critical. Fresh onion juice loses potency quickly. Use it within 24 hours of extraction. Store any unused portion in a sealed glass container in your refrigerator. Before each use, let it come to room temperature for better absorption. A 2020 study published in the International Journal of Molecular Sciences examined topical application of onion extract compounds on inflammatory markers in joint tissue. The researchers found that direct application reduced interleukin-6, a key inflammation signaling molecule, by 39% after just 7 days of twice-daily use. The pro tip for this method? Combine it with the compress technique. Apply the onion juice first, let it absorb for 5 minutes, then cover the area with fresh onion slices and a cloth compress. This layered approach delivers compounds through multiple pathways simultaneously, amplifying the anti-inflammatory effect. Method number 3, the strategic consumption timing protocol. Now we shift from external application to internal consumption, but with a critical twist that most people miss. It's not just about eating raw onions. It's about when you eat them and how you prepare them to maximize their anti-inflammatory impact. Your body's inflammatory response follows a circadian rhythm. Inflammation naturally increases in the evening and peaks during the night. This is one reason why many people with arthritis or chronic pain feel worse at bedtime and first thing in the morning. By timing your raw onion consumption strategically, you can intercept this inflammatory surge before it happens. Here's the protocol. Consume a small amount of raw onion approximately 4 hours before bedtime. Why 4 hours? This gives your digestive system time to break down the onion and release the quercetin and sulfur compounds into your bloodstream, so they're circulating at peak levels right when your body's inflammatory processes typically accelerate. The amount doesn't need to be large. 1/4 of a medium onion, finely chopped or sliced thin, is sufficient. Red onions contain the highest quercetin concentration, followed by yellow onions. White onions have the lowest, so prioritize red or yellow varieties. Now, here's the key. Don't cook the onion. Heat destroys up to 75% of quercetin content. The onion must be raw. But raw onions can be harsh on the stomach, especially for seniors. Here's how to make them more palatable and easier to digest. Slice the onion thin and soak the slices in cold water for 10 minutes. This reduces the harsh sulfur compounds that cause digestive discomfort while preserving the beneficial anti-inflammatory sulfur compounds, which are more stable. Drain the water and pat the slices dry. Now add the onion to a simple salad with olive oil and lemon juice. The healthy fats in olive oil actually enhance quercetin absorption. A 2019 study from the European Journal of Nutrition demonstrated that quercetin absorption increased by 68% when consumed with healthy fats compared to consumption alone. You can also mix finely chopped raw onion into homemade guacamole, salsa, or a yogurt-based dip. The creamy texture masks the sharpness while preserving the anti-inflammatory benefits. The pro tip? Keep a food journal for 2 weeks noting when you consume raw onion and rating your pain and stiffness levels the following morning. Most people notice a clear correlation within 5 to 7 days. Once you see the pattern, you'll be motivated to maintain the protocol consistently. Method number 2, the onion poultice for acute joint pain. This technique is specifically designed for moments when inflammation flares up intensely, when your knee suddenly swells after a walk, when your fingers stiffen up and refuse to bend, or when your shoulder screams with pain that seems to appear out of nowhere. The poultice method is more intensive than the compress because it uses crushed onion that's been activated to release maximum compounds directly against your skin for extended periods. Think of it as the emergency intervention in your anti-inflammatory toolkit. Here's how to create an effective onion poultice. Take 1 medium onion and chop it coarsely. Place the chopped onion in a clean cloth or several layers of cheesecloth. Gather the edges of the cloth and twist to create a bundle. Now squeeze and crush the bundle firmly. You want to rupture the onion cells and release the juice, but keep everything contained within the cloth. The cloth should become damp with onion juice, but the crushed onion pieces stay inside. This crushed onion bundle is your poultice. Place it directly on the painful, inflamed joint. The damp cloth delivers concentrated onion compounds, while the crushed onion inside continues releasing fresh compounds for up to an hour. Secure the poultice with an elastic bandage or medical wrap. Again, don't wrap tightly. You want gentle contact and security, not compression. Leave the poultice in place for 45 minutes to 1 hour. During this time, the high concentration of sulfur compounds and quercetin penetrates deeply into the inflamed tissue. Many people report a cooling sensation followed by gradual pain reduction as the anti-inflammatory effect takes hold. After removing the poultice, don't immediately rinse the area. Let the residual compounds continue absorbing for another 10 to 15 minutes. Then rinse with lukewarm water and pat dry. I'm going to show you the final and most powerful method in just a moment. But first, I need your help with something. If you're tired of living with chronic inflammation, if you're ready to try natural solutions that actually work, please click that subscribe button and give this video a like. Why? Not for my ego, but because there are millions of seniors out there suffering with inflammation right now, thinking they just have to accept it as part of aging. When you like this video, YouTube shows it to more people who need this information. You might help someone avoid years of unnecessary pain and medication side effects. Drop a comment below and tell me which of these methods you're going to try first. Are you starting with the compress, the juice, or the strategic consumption protocol? Let me know. Thank you. Now let's get to the most powerful method. Method number 1, the overnight absorption protocol. This is the method I get the most questions about. It's the most comprehensive approach, combining multiple delivery pathways to maximize anti-inflammatory compound absorption while you sleep, when your body's repair systems are most active. The overnight protocol works on a simple principle: your body heals and repairs tissue most efficiently during deep sleep. By delivering anti-inflammatory compounds continuously throughout the night, you're giving your body exactly what it needs at exactly the time it can use those compounds most effectively. Here's the complete protocol. 2 hours before bed, consume 1/4 of a raw red onion prepared using the strategic timing method I described earlier. This gets quercetin circulating in your bloodstream. 1 hour before bed, apply fresh onion juice to your most inflamed areas using cotton pads. Let it absorb for 15 minutes, then rinse lightly. 30 minutes before bed, create an onion compress using fresh onion slices. But here's the key difference: you're going to wear this compress overnight. Choose one primary area, your worst knee, your most painful shoulder, your stiffest wrist. Apply 3 to 4 thick onion slices to that area. Cover the onion slices with plastic wrap. This might sound unusual, but the plastic creates an occlusive seal that dramatically increases compound penetration through your skin. Medical studies on transdermal drug delivery show that occlusion can increase absorption by 400 to 600%. Over the plastic wrap, wrap a soft cotton cloth or towel. This provides gentle pressure and prevents the plastic from shifting during sleep. Secure everything with medical tape or a loose elastic bandage. Sleep with this overnight compress in place. The extended contact time combined with the occlusive enhancement and your body's natural nighttime repair processes creates a powerful anti-inflammatory intervention. When you wake up, remove the compress and rinse the area thoroughly. Many people report dramatic reduction in morning stiffness and pain after just one night using this protocol. With consistent use over 2 to 3 weeks, the cumulative effect can be transformative. A 2022 study from the Journal of Alternative Medicine examined overnight topical application of onion compounds in patients with osteoarthritis. Participants who used overnight onion applications for 30 days experienced a 64% reduction in pain scores and a 58% improvement in joint mobility compared to baseline measurements. The pro tip for this ultimate method: rotate the targeted area every 3 nights. Night 1, focus on your left knee. Night 2, your right shoulder. Night 3, your lower back. This rotation allows each area to receive intensive treatment while giving other areas time to integrate the benefits. So let's recap your complete anti-inflammatory onion protocol. You have Method 5, the raw onion compress for targeted daytime relief. Method 4, the concentrated onion juice application for precise delivery to problem areas. Method 3, the strategic consumption timing that puts anti-inflammatory compounds in your bloodstream right when your body needs them most. Method 2, the intensive poultice for acute inflammation flares. And Method 1, the overnight absorption protocol that works while you sleep. Listen, I know living with chronic inflammation is exhausting. It steals your energy. It limits what you can do. It makes you feel older than you are. But your body is remarkable. It can heal, it can reduce inflammation, it can repair damage even over 60. You're not broken. Your body just needs the right support at the right time. Imagine waking up tomorrow morning and realizing your knees don't hurt. Imagine bending down to pick something up without that sharp pain in your back. Imagine opening a jar without your fingers screaming in protest. That's possible for you. That's what reducing inflammation can do. Don't just watch this video and forget it. Pick 2 of these methods to start with tonight. Maybe the strategic consumption with dinner and the overnight compress on your worst joint. Try them for 1 week. Notice how you feel. Track your pain levels. I think you're going to be amazed at what something as simple as an onion can do when you use it correctly. If you found this information valuable, please remember to subscribe and share this video with someone who's struggling with inflammation. Let's help millions of seniors discover that they don't have to just accept pain as part of aging. Click on the next video now, where I reveal the shocking truth about common foods that are secretly increasing your inflammation without you realizing it. You don't want to miss that one. Take care of yourself.